My name is Jeffrey Batkin, and I live in Saluda, North Carolina. My background includes being a priest for 43 years. I've been retired for the last year and a half, actually. I was a pretty active fellow. I'm a tennis player. I was a golfer. I rode my motorcycle. I like to hike in the mountains. Those are the things I did mostly. As I was out working in my yard one day using a blower to take care of my leaves. And it was one of those heavy blowers that you strap onto your back. And in the movement back and forth with the heavy blower, apparently that was the thing that threw everything over the edge.
He started having problems with pain and having epidural injections. And that worked pretty well for a while. Didn't really cure the problem, but it stopped the pain, so he was still fairly active, and then it just progressively got worse. There came a point where the doctor felt like that wasn't going to do it and that he should have the back surgery, which he did. And it technically went well, but it didn't really, it caused other problems. He was on a lot of pain medication and pretty much out of it, really. We couldn't go anywhere or do anything. We couldn't stay in a motel because he couldn't sleep in a bed. It was almost like he wasn't here because he was on so much medication. He just slept all the time.
And I had been basically incapacitated most of that time. I could take a short walk, but I was in pain. I was on a lot of medication. And I had not laid in a horizontal position in over a year. The process of having the test neurostimulator for me was very easy.
They walked him back to the room where I was waiting and connected everything and turned it on, and he was amazingly much better. I mean, he stood up and he walked down the hall and didn't have any pain. I mean, there was a noticeable difference.
It was like instantaneous. I walked out of the hospital relatively pain-free. I would say 90 to 95% pain-free. And I slept in the bed that night, horizontal, for the first time in a year. For me, it worked. And if it does work for you, it's still not going to be perfect. There are some limited drawbacks to having it, but for me, the drawbacks don't outweigh the positive things that come with it. I have been so much better without medication that I'll take whatever drawbacks come with this. And that's what I try to explain to the people that I tell. I have some difficulty sleeping sometimes because of the thing. So there are trade-offs, but the trade-offs are worth being able to be out there hiking, playing golf, riding my motorcycle, playing pickleball, fishing, painting, and being alert to the world around me. Those are the things that I'd rather have.
These are actual patient stories. The stories are the experience of these individuals only. Although these patients did not experience complications, there can be risks and potential complications associated with the use of medical devices. If you are interested in learning more, please consult your physician. CE marking does not necessarily indicate regulatory approval status for all markets. Please refer to the instructions for use for a full listing of indications, contraindications, warnings, and precautions. RX only. Brief summary. Prior to using these devices, please review the instructions for use for a complete listing of indications, contraindications, warnings, precautions, potential adverse events, and directions for use. Indications for use. Spinal cord stimulation as an aid in the management of chronic, intractable pain of the trunk and/or limbs, including unilateral or bilateral pain associated with the following: failed back surgery syndrome and intractable low back and leg pain. Contraindications: Patients who are unable to operate the system or who have failed to receive effective pain relief during trial stimulation. Warnings, precautions. Diathermy therapy, implanted cardiac systems, magnetic resonance imaging, MRI, explosive or flammable gases, theft detectors and metal screening devices, lead movement, operation of machinery and equipment, postural changes, pediatric use, pregnancy and case damage. Patients who are poor surgical risks with multiple illnesses or with active general infections should not be implanted. Adverse effects: painful stimulation, loss of pain relief, surgical risks, e.g. paralysis. User's guide must be reviewed for detailed disclosure.